Welcome back to the Deep Dive. Today we are plunging into a topic that remains wrapped in a pretty confusing layer of shame and secrecy. The world of vaginal health and natural odor.
It really is. It's a space where so much confusion reigns, mostly because we're constantly told the ideal state is, no state.
That it should smell like nothing.
Exactly, or maybe like a synthetic garden. And the truth is, that expectation is just chemically and biologically unrealistic. Our sources for this, which range from clinical guidelines to metabolic studies, they all highlight that the marketing for douches and specialty washes is actually promoting practices that are actively harmful.
Right, because they destroy the natural defenses.
They completely destroy them.
Absolutely. Yeah. So our mission today is to cut through all that noise and, demystify the sense you might experience. We want to help you distinguish between what's a normal change and what's a genuine signal of an imbalance.
And we're using some fascinating clinical trial results, especially around preventing infections from coming back, to give you some really actionable, evidence-based knowledge.
Okay, so to start, we have to establish the healthy baseline.
We have to. A healthy vagina is this robust, living ecosystem, and it absolutely has a natural scent. It's often described as, musky, tangy, or slightly sour.
And that scent isn't an accident. Yeah. It's a sign that its defense system is working.
It's a byproduct of it working optimally. And when we talk about that defense system, we're really talking about acidity.
Right. And the sources peg a healthy pH somewhere between 3.8 and 5.0.
That low pH is the absolute foundation of its health. And that acidity is maintained by protective bacteria, the lactobacilli.
The good bacteria.
The good bacteria, they dominate the environment, they produce lactic acid, and that acid makes the whole place inhospitable to harmful pathogens. So when the system is balanced, it smells like a system hard at work.
So let's start with those normal fluctuations, because I think that's where the confusion really begins. If you expect a static, unchanging scent, you're just setting yourself up for worry.
You are. The odor naturally changes all the time. Your menstrual cycle, exercise, even just sweat, it all has an impact.
Okay, so what's the primary healthy scent we need to recognize?
The main one is what we'd call a fermented smell.
I noticed in the materials this is often compared to things like sourdough bread or plain yogurt. Why is that the go-to analogy?
It's a perfect comparison, really, because it gives you a scent descriptor for lactic acid production. That sour, fermented aroma is literally the smell of the lactobacilli doing their job. It smells like healthy, active bacteria.
So if you smell that, it usually means your pH is right where it needs to be.
Generally, yes. Now, there is a slight wrinkle. A yeast infection or candidiasis can sometimes produce a faintly sweet or bread-like smell, too.
But there are other symptoms there.
Always. That smell will almost always be accompanied by intense itching and that classic thick cottage cheese-like discharge. The discharge and the itching are the key differentiators.
Okay, let's talk about a scent that seems to cause a lot of alarm. The coppery or metallic smell. You smell that, and you immediately think something is wrong.
It's understandable, but this is usually just chemistry. Specifically, it's iron. That metallic scent is almost always due to the presence of iron in blood.
So during your period?
Exactly. You notice it most intensely during menstruation, but it can also happen for a short time after sex if there was any minor bleeding or spotting. It's a transient signal of blood and almost always benign.
And what about reports of a sweet smell? You hear those old tales about eating pineapple or grapefruit.
Yeah, those diet theories are fun, but they aren't really backed by science as a consistent cause. The sweet scent itself is generally just connected to a natural fluctuation in the bacteria and the shifting pH. It's not usually a cause for worry.
Okay, now for the ones that sound truly alarming, the ammonia or bleach-like scent.
This is one where you really need to check outside the vaginal cavity first. Most of the time, the cause is external.
Like urine residue.
That's the most common culprit. Urea in urine breaks down into ammonia really quickly, especially if it concentrates because you're dehydrated or if it just lingers on underwear. It's an external hygiene thing, not an internal infection.
That's a great distinction. Or sweat too, right?
Yeah.
The groin is a major source of body odor.
It is. The groin has a high concentration of apocrine sweat glands. When that sweat mixes with bacteria on the skin, it can produce that kind of chemical body odor smell. A chemical odor is sometimes cited as a symptom of bacterial vaginosis or BV, but, the benign causes are just overwhelmingly more common.
So we've established the spectrum of normal. Let's draw a clear line and discuss the two major warning signs described in the clinical sources. Let's start with the one that screams emergency, the rotten or foul smell.
Right. If an odor shifts from just being off to truly rotten or putrid, that is an emergency signal. This isn't subtle. It's a powerful, unmistakable stench that requires immediate medical attention.
And what is the most common specific cause of an odor that strong?
We have to be direct here. The vast majority of these cases are caused by a foreign object that has been forgotten inside the vaginal cavity.
Like a tampon.
A tampon, a menstrual cup left in too long, or even a piece of a condom. That trapped material becomes a massive breeding ground for anaerobic bacteria, causing rapid decomposition.
I see. And are there other, more serious causes?
In extremely rare cases, yes. A foul or even fecal odor can be associated with tissue decay from advanced conditions like cervical cancers or something called a rectovaginal fistula, but the forgotten object is by far the most common and urgent scenario.
Okay, let's move to the second major red flag, and this is the one that drives most people to seek help. The classic, pervasive, fishy odor.
This is where the science really connects directly to the symptom. The specific chemical culprit is a compound called trimethylamine, or TMA.
TMA.
It's essentially a biological exhaust gas. It's produced when certain undesirable anaerobic bacteria, the kind that thrive in an unbalanced, non-acidic vagina, reduce other compounds like choline.
So the fishy smell is actually a chemical warning signal that the wrong type of bacteria are taking over the ecosystem.
That's the implication. And to connect this to the bigger picture, it really highlights how powerful TMA metabolism is in the body. I mean, think about the rare metabolic disorder called trimethylaminuria.
Fish odor syndrome, or FOS. Why is this rare condition important for us to talk about?
Well, in people with FOS, a critical liver enzyme fails to neutralize the foul-smelling TMA into its odorless form. And because the liver can't handle it, the TMA is excreted through every possible route: sweat, urine, breath.
Wow, so it leads to a pervasive fishy odor across the entire body.
Exactly. It proves that this specific odor is rooted in complex chemistry that the body normally has to manage. And while FOS is rare, understanding its systemic impact, the anxiety, the depression it causes, it really validates the psychosocial weight of a localized fishy odor. It shows us that addressing TMA is not just about comfort, it's profoundly linked to well-being.
That provides crucial context. Now let's return to the two main vaginal conditions that actually produce that common, localized fishy odor: bacterial vaginosis and trichomoniasis.
These two are the primary reason for odor complaints in a healthcare setting. Bacterial vaginosis, or BV, is the most common vaginal condition globally. It affects up to 30% of women annually in key reproductive age groups.
And as we said, BV is a dysbiosis. It's not strictly an STI, though sex is a major risk factor.
Correct. It's an imbalance where the protective lactobacilli are drastically reduced, allowing harmful anaerobes like Gardnerella to overgrow. This shift causes the vaginal pH to rise above that healthy 4.5 mark, which is what facilitates the TMA production.
So besides the fishy smell, which the sources say is often worse after sex or during your period, what's the key feature of the discharge you should describe to a doctor?
For BV, the discharge is typically thin, watery, white, or gray, and it looks homogeneous. It often appears as just a light coating on the vaginal walls. The challenge, though, is that up to 84% of cases can be asymptomatic.
So the odor might be the only indicator.
It might be. And the risk factors we have to stress include douching, using those feminine hygiene products, and, yes, sexual activity with new or multiple partners.
Okay, let's pivot to the second major culprit, trichomoniasis, or trich. This one is fundamentally different. It's a parasite.
It is. Trich is caused by the parasite Trichomonas vaginalis, and unlike BV, it is classified as a common non-viral STI. It's almost exclusively transmitted sexually.
Since both can cause a fishy or foul odor, how can you use precise language to help a doctor differentiate them based on the discharge?
The description is everything here. Trichomoniasis discharge is remarkably distinct. It's often described as thin and frothy, and its color is typically green or yellow-gray.
And that usually comes with other symptoms too.
Usually. Intense genital itching, irritation, and a burning sensation when you urinate are very common. But like BV, a huge number of people, about 70%, are asymptomatic, which is why testing is so critical.
What's fascinating is the high rate of co-infection.
Exactly. Clinical studies show a major overlap. A large percentage of individuals diagnosed with trich, sometimes up to 80%, also have BV at the same time. This reality just underscores why trying to self-diagnose is a bad idea. You need professional testing.
That takes us right into the diagnosis process. If you notice a persistent fishy odor or any of these concerning symptoms, what are the red flags that mean you absolutely need to see a doctor?
The signals are clear. A persistent, noticeable fishy odor, any marked change in discharge color, especially green or yellow, burning or pain during urination or sex, persistent itching, or a fever. You just need a definitive diagnosis.
So what specific tools will a professional use to figure out what's going on?
The standard workup usually starts quickly. First, a pH test. They'll check the vaginal pH, and if it's above 4.5, that's a strong indicator of either BV or trich. Second is the whiff test.
The whiff test?
Yes. A discharge sample is mixed with potassium hydroxide. If it produces that strong, characteristic fishy odor, it's considered diagnostic for BV because it releases those volatile trimethylamines.
That's the chemical proof right there. And then we move to the lab.
Yes. Microscopy lets them look for clue cells, which are characteristic of BV, or, crucially, to see the motile parasites that cause trich. But for the highest accuracy, they rely on NANETs, or nucleic acid amplification tests.
What are those?
They're sophisticated lab tests that detect the actual genetic material of the parasite or the specific bacteria associated with BV. They're the gold standard.
Before we move on, let's go back to prevention, because you mentioned douching is a major risk factor for BV. Why is avoiding it so critical?
Douching is maybe the most destructive thing you can do to the vaginal ecosystem. By forcing liquid up into the cavity, you physically flush out the entire population of protective lactobacilli.
You're just wiping the slate clean.
You are. You disrupt that crucial acidic shield, and the pH instantly rises. This creates a vacuum, making the environment wide open for harmful bacteria to colonize, which not only increases the risk of BV, but also serious complications like pelvic inflammatory disease.
So the key preventative steps are simple. Just warm water for the external vulva and breathable cotton underwear. Nothing fancy needed.
Simple, consistent support is always the best approach.
Okay, let's discuss the frustrating reality of treating BV. You get antibiotics, the symptoms clear up, but the recurrence rate is so high, over 50% within a year. Why does it keep coming back?
The irony is that the treatment itself often sets the stage for the relapse. Antibiotics cause what's called antibiotic-associated vaginal dysbiosis. They're indiscriminate. They wipe out the bad bacteria, yes, but they also obliterate the protective lactobacillus species.
So you're left with no defenses.
Exactly. It leaves the environment severely compromised, a kind of biological vacuum ready to be rapidly recolonized by the bad guys as soon as the treatment stops.
So the goal isn't just to kill the infection, it's to immediately rebuild that defensive wall. And this is where those targeted oral probiotics come in.
Precisely. We looked deep into a randomized, double-blind, placebo-controlled trial that evaluated specific oral probiotic strains. The strains were Lactobacillus rhamnosus GR1 and Lactobacillus reuteri RC14.
And what did that research show about the health of the microbiome right after antibiotic use?
It showed a really significant protective effect. Researchers used what's called a Nugent score to measure the level of bacterial health. In the placebo group, the dysbiosis scores rose sharply, but the probiotic group maintained significantly lower, healthier scores.
And what does that mean in terms of, actual infections coming back?
The clinical outcomes were dramatic. This is where the data gets critical. Probiotic supplementation hugely reduced BV incidence. After treatment, 40% of the placebo group developed BV.
40%, okay.
Compare that to only 8% in the probiotic group. At the final follow-up, 48% of the placebo group had a recurrence versus only 12% in the probiotic group.
Wow. That reduction from nearly half relapsing to just over 1 in 10, that is a huge finding. It's real evidence that these adjunct therapies are essential to stop that cycle of antibiotic dysbiosis recurrence.
And it wasn't just on paper. The probiotic group also reported significantly fewer symptoms. Discharge, odor, irritation, only 24% of them reported any symptoms at follow-up compared to 52% of the placebo group. The evidence is just very clear.
So BV and trich require prescription medication.
Absolutely. But adjunct therapies like specific oral probiotics or even prescribed boric acid suppositories for recurrent cases show immense promise in rebuilding that critical acidic shield.
So what does this deep dive mean for you, the listener? We've covered everything from the musky fermented scent of health to the distinct chemical signals of TMA.
The central takeaway is that knowledge really provides power and reduces shame. You have to learn to distinguish between the normal odor fluctuations, the transient fermented or metallic scents, and the real warning signals,
which are that persistent fishy smell or, critically, a putrid rotten odor.
Exactly. The ultimate strength of your health lies in the balance of your natural flora and that robustly acidic pH.
And crucially, this knowledge arms you with the precise language you need to talk to your healthcare provider. Instead of walking in and feeling embarrassed saying, "I smell bad," you can now walk in and say something like, "I'm noticing a persistent fishy odor with thin grayish discharge, and I think my pH is raised."
That level of detail, or describing frothy green discharge for trich, is what helps the doctor get to an accurate diagnosis immediately, whether it's with a pH check, a whiff test, or NATs. It ensures you get the right treatment the first time.
And as we close this deep dive, let's leave you with one final thought to consider. Since the vaginal microbiome is so easily disrupted by things like antibiotics and douching, and given that the beneficial lactobacilli thrive in an acidic environment, what simple, consistent, non-invasive steps beyond supplements could be used daily to support and maintain that crucial, protective, low pH boundary? A question worth discussing further with your doctor.